According to the World Health Organization, about 200 million persons in the world are infected with the malaria parasite. The report released by the World Health Organization says Nigeria is one of the 3 African countries with the highest cases of resistant malaria. Today on Sound Health, we will look at how to curb the scourge. I'm Olasumbo Mudukwe. Welcome to the show. Thanks for staying with us. It's still Sound Health on Lagos Television. Today we are looking at how to curb the scourge of resistant malaria in Nigeria. And I have with me Dr. Chidunga Ohazurike, Member Association of Public Health Physicians of Nigeria, Lagos State Chapter. Welcome to the program.
Thank you very much.
Looking at malaria, it was discovered 18 centuries ago, but unfortunately we still have it as common as water everywhere. Why is this so?
Okay, as you rightly stated, malaria is very common and is one of the oldest diseases known. But however, in Nigeria, malaria is still one of the leading causes of death, especially among children under 5. Okay. Then even in adults, though it may not lead to deaths as much in adults due to immunity, but it's still a significant contributor to manpower losses as per in relation to number of lost days on the job or even man hours lost due to visits to hospitals for malaria treatments. So as a country, I don't think Nigeria to relegate malaria to the background is still one of a significant cause of both morbidity and mortality in Nigeria.
But why is this still so?
I think a number of factors contribute to that. Sometime in 2005, 2006, there was a change in the treatment of malaria. There was a change because of studies that were done, as you said, resistant malaria. Then it was found that the drugs that we're using, the chloroquines, the sulfadoxine, pyrimethamines, like the fancidas, were becoming resistant to, as in the disease was not responding to these treatments. They were no longer effective, and this led a move to what we call the artemisinin combined treatment, which is a combination treatment. So instead of using single dose therapy for treatments of malaria, or monotherapies as we call them, we now move to the use of combination therapy for malaria, and this is what is now in the forefront.
When do you tag a malaria resistance?
And resistant malaria is when the malaria is resistant to the drug, to the drug that you're using. And things that can cause that is either you're using the inappropriate drug or you're using the appropriate drug in the wrong dosages. So if you use, even if it's the appropriate drug and it's being used in the wrong dosage, it could cause resistance. And it's important to know that resistance may not just be at the individual level. If someone who has resistant malaria gets bitten by another mosquito, if the mosquito is carrying that parasite, it can transmit that resistance to another person. So it's not just, so I think we should be our brother's keepers in trying to make sure that I seek appropriate diagnosis and treatment, not just for myself, but to protect the people around me. So it's from the inappropriate use of drug that you get resistant malaria.
According to the World Health Organization, Nigeria is one of the 3 African countries with the highest increased cases of malaria. How did we get here? Okay,
as you rightly said, the way forward would be for the government, for every stakeholder. The stakeholder would even include the individual. So now there are things that can be done for prevention of malaria, but even starting at the individual, you as a person, where you live, how is your environment? How do you keep your drainages? Are your drainages clean? Because these drainages provide the breeding places for the vector, which is the Anopheles mosquito. Now, so moving from there, even if someone gets bitten by an infected female Anopheles mosquito and falls ill, the next step is early diagnosis and treatment. So the person needs to get to a facility very quickly. Now, another thing that is one of the strategies now is what we call test and track. So it's gone are the days of just giving, oh, you have fever. Every fever is not malaria. you have fever, you just get treated for malaria. So when you get to the facility, you have to be tested with what we call a rapid diagnostic test. So in 10-15 minutes, you know whether this person has malaria or not before you go ahead and treat. Then, even at the point of treatment, then the healthcare worker who is providing that care should give you a combination treatment. That is the ACT that we're talking about. Okay. Then those are the things.
Okay, before now, insecticide-treated nets, all these insecticides have helped to reduce the number of cases, but the reverse is the case now.
In looking at that, because for prevention of malaria, yeah, you have your short-term strategies and you have your long-term strategies. Indoor residual spraying or aerial spraying is a strategy to combat malaria. Okay. But when you look at the vector, it's been found that some species of the vector are becoming resistant to the insecticide that is used for indoor residual spraying or for aerial spraying. But what Lagos State has tried to do is to do what we call an entomological survey. So they've gone to different parts of Lagos trying to find out which vector is specific to which area and trying to find out which insecticide is best for that area. So it is research that can move us forward in that line. So finding out the gaps and then trying to rectify those gaps would go a long way to combat.
Still on insecticide treated nets, people in low and middle income countries hardly adopt this technique before the report released by the World Health Organization. What do you think can be done to make them embrace this, especially now when we have resistance malaria?
Coming to the utilization of insecticide treated nets, studies have been done. And there seems to be a gap because some people did some studies after a distribution campaign. And they found out that even for people who had access or who have these insecticide-treated nets, they were not using it. Okay. Now, they went further to find out or to ask why, why they were not using it. A lot of things came up. One majorly was the weather. Some people felt it's already hot or Nigeria is a humid country, and then having to sleep under the insecticide-treated nets would even make it hotter. Then people also had challenges with the hanging of the nets, So you have to position your bed in a particular position so that the nets can appropriately cover your bed. So, but prevention is always cheaper than cure. So I think in that light, we would continue to enlighten, will continue to educate the public so that they would use it. For the people who have access to the nets, they will continue to use it, especially for pregnant women and children under the age of 5, because these ones are even more vulnerable than the average adult to malaria.
The World Health Organization has advocated increased funding on the part of the federal government in countries where we still have increased resistant malarial cases. What's your take on this?
Okay, for us in developing countries, funding is a major problem, but I would like to look at it this way, that would begin to do our own research and utilize the results from that research, because we have a lot of research that has not gone out into public domain or has not gone into the hands of those who maybe manufacture drugs or who maybe import drugs. So I would recommend more collaboration or increased collaboration between the researchers and the producers. And then we'll begin to look for what I call homegrown solutions to our own problems, because we cannot continuously depend on donor funding. We can't go so far with donor funding. But as a country, as a people, if we continue to look inwards to find our own homegrown solutions to our own problems, we may not be requiring so much funding from the donor agencies.
Okay, Doctor, on a final note, what are some of the tips members of the public can adopt to keep malaria at bay?
The age-long prevention methods for malaria, so keep your environment clean, avoid having flooded drainages where they can act as breeding places for these vectors. Then wearing protective clothing is also there, so that if you protect your skin, the mosquitoes will not find a place to bite, and use of mosquito repellents. So those things, but I would always suggest that the environmental solution or the environmental strategy of keeping your environment clean is the long-lasting approach, because every other thing will now be on the individual basis. But the environmental solution is a long-lasting approach to combat malaria. I mentioned earlier about early diagnosis and treatment. So it's important that if someone has a fever, which is the commonest symptom for malaria, you should get to a healthcare facility and get tested and then get treated. And whoever it is that is treating would recommend an artemisinin combined therapy for the person seeking care. And then it's also important that in Nigeria, people try to use all sorts to solve their ailments using herbal concoctions. But if it's really malaria, it's important that you seek appropriate care and get the appropriate treatment.
All right, thank you so much, Doctor, for sharing your expertise with us on Sound Health.
Thank you very much for having me on the program.
All right, it's a pleasure.
Thank you.
All right, that has been Dr. Chidum Gaohazurike, a member Association of Public Health Physicians of Nigeria, Lagos State Chapter, on curbing the scourge of resistance malaria in Nigeria. Sound Health continues with trending and home essentials. Please stay with us. That's Sound Health this week. Hope you've learned a few things on managing resistant malaria. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at HealthTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.